Thank you for inviting the Emed4u team in taking part in this event. My name is Dr. Andreea Sharma and I work as a psychiatrist in UK in child and adolescent mental health services. I am here today trying to provide a bit more information about the use of antidepressants in treating symptoms of depression in child and adolescent group of patients. It is important to understand a little bit more about the use of such tablets, particularly when people are having different level of expectations regarding the efficacy of these antidepressants. Just as a bit of background information, it is important to understand that the children's and adolescents' mind is still under development in this age group, and they experience a lot of changes throughout their body and brain. These are hormone related and can be transitory. Such effects can have different presentations in terms of the diagnosis of mental illnesses, that including depression. It would be crucial for the diagnosis of mental health illnesses to be done by a specialist, and in particular the prescription of treatment. At present, it is only fluoxetine from the group of medication called SSRIs that it is considered to have an evidence base in being prescribed for treating moderate and severe depression. It is crucial that access to talking therapies, psychological therapies, is attempted first before the prescribing of the medication. Once and upon consultation with a specialist, the decision is made that the talking therapies has been tried sufficiently for a number of sessions, then the decision to have the medication considered should occur. It is usually considered sufficient to try 4 to 6 sessions of the talking therapies and then to receive appropriate information through face-to-face contact with your doctor, your specialist, and obtain written information to refer to as well. The decision should be made jointly between that child, adolescent, as well as the parent or the carer, as it is crucial for the medication to be administered correctly, to be taken regularly, as well as to manage the expectations of the duration of the treatment before deciding if to continue with that particular medication or consider something different. The understanding should be that generally with mental health medication, particularly antidepressants, the duration of the treatment is generally a number of weeks before noticing any change in the symptoms. For example, fluoxetine being the first medication that should be tried in treating depression in children and adolescents, it is an understanding that we should expect 6 to 8 weeks of being on the treatment before assessing if that medication requires continuation. It is at that point in time when the doctor and the patient with their family should take the decision if to increase the medication or to the medication dose, or to even consider a change. And then I'll talk about possibility of changes at a later stage. Part of the initiation of the antidepressant is making sure that the first period of time since the initiation is assessed appropriately. Monitoring of symptoms in the first 4 weeks since starting therapy with antidepressant is extremely important. There are side effects which are linked to suicidal thinking, even suicidal attempts, that increase the risk in this particular first period of starting the medication. In addition to potential increase of suicidal thinking, patients can experience increase in irritability, experience of bouts of anger, as well as being noticed that they become more oppositional in their behavior. The practice in UK advises that professionals should make contact on a weekly basis with the parents and the child, and the close monitoring of all these symptoms should be taken as a priority. Thank you very much. Namaste.